Have you opened the room?
I don't see anything yet.
Okay, that's odd. That is really odd. We had 147 registrants. I know somebody is joining. Because we're still in practice session. Okay. Has this ever happened to you, Heather? Oh, no.
Coming in.
Okay. Hello, everybody. Welcome. We are just letting the room populate. Sorry for the couple minutes delayed. I think it was a Zoom glitch there. All right. Okay, looks like we can go ahead and get started. Good morning or good afternoon, wherever you are joining from. My name is Melissa Gray. I'm the Assistant Director of Transportation for the National Aging and Disability Transportation Center, and I want to welcome you to today's webinar, our first installment of our Human Services Initiative webinar series. And this webinar is on vaccination access and transportation. So welcome. Just a few housekeeping items. All of our participants are muted. This session is being recorded. All of the materials, including the recording, will be put on the NADTC website, so you can access that at a later date if you choose to. Closed captioning is available. You can turn that on by clicking on the CC closed captioning button at the bottom of your screen. And would ask that you would please put any questions that you have for any of our presenters today in the Q&A box. The chat is open, but typically used for general questions or any technical assistance that's needed. So we welcome you to do that as well. And a brief overview about of our webinar today. Again, my name is Melissa Gray. I'll do a really quick overview of the NADTC in case this is your first webinar with us. And then I will I'm happy to introduce our presenters to you today. We'll have Jennifer Hammer. She's the Assistant Director of the Aging and Disability Vaccination Collaborative with U.S. Aging. We have Jenny Pirtle, Director of Communications and Community Engagement with Together Austin, Vax Together Austin. Seth Wells, Executive Director with the Rise Center for Independent Living. And then finally, Leanne Eagle, Director, Health and Wellness Program with MAC Inc. And so excited for each of my presenters to be here today. And we will leave some time at the end for questions and answers. So please gather any questions that you might have for these wonderful presenters. So a little bit about the NADTC. Our mission is to promote the availability of accessible transportation options for older adults, people with disabilities, caregivers, and communities. And we do have a few primary objectives, the things that we provide. Primarily, we are a technical assistance and training center funded by the Federal Transit Administration. We are a co-administered TA center between U.S. Aging and Easter Seals. We also offer a host of publications and resources on our website, including a technical assistance coordination library, as well as a funding resource guide, which has come in handy to many of our local programs on how to find and secure funding for some of the innovations that they're working on in their community. We have a partnership and coordination initiative, which includes a coalition toolkit. And every year we put out an annual grant funding project where we provide funding for local communities that are providing innovations in transportation for older adults, people with disabilities, and caregivers in their communities. And that is where you can reach us. You can use the QR code and that advance on its own. So let me go back up a little bit. Just a little bit about these human services webinars. This is a new initiative for the NADTC starting this year, and this is the first one. This will include a series of webinars that are targeted to the needs of human services transportation providers, and in particular, programs that are operated and administered by AAA's, Title VI Native American programs, Center for Independent Living, and other disability and aging-focused organizations in tribal nations. And you actually get to hear from a few of those folks here today, so we're excited about that. So with that, that is our contact information, and I want to turn things over now to Jennifer Hammer.
Thanks so much.
Oh, Jennifer, having a little bit of trouble hearing you. You're coming in and out.
Does it help if I don't? Does that help?
A little bit.
No, it's just working.
Yeah, so go ahead and present without your camera off.
Okay, we'll
With your
try it.
camera.
There's all this. So let's go and look at the grand summary. So many people think, you know, what got stated is such a- but there's been first round. So this aging. Melissa's out.
Yeah, we're still having some problems hearing you, Jennifer. So
Yeah. Should I dial back?
you could just dial in, but for the sake of time, I'm going to go ahead and move on to Jenny. And,
Okay.
you know, we'll have you wrap up kind of towards the end, because I want these folks to definitely hear about the program that these presenters are actually taking part of. So apologize, everybody, but we'll have Jennifer dial in. And with that, Jenny, hopefully you are ready to go.
Hi, everyone. My name is Jenny, and I am with Together Austin. I'll tell y'all a little bit about our background, who we are and what we do, and then give you some background on the transportation program that we are launching this summer. Next slide. So Together Austin is a pandemic-born nonprofit organization. We are based in Austin, Texas, serving the Central Texas area. Ever since our first COVID-19 vaccine clinic in April 2021, we've been able to facilitate over 20,000 shots in arms. And our very first clinic was facilitated through our current staff and board, many of whom were very heavily involved in helping make vaccine appointments for people online. And through that work, our executive director, Sharon Cohan, was able to discover that a lot of people who were blind or who had low vision were really struggling to get those vaccine appointments. And many of them worked for the same place called Austin Lighthouse for the Blind. These folks were essential workers who had been working throughout the pandemic. And unfortunately, no vaccine providers had agreed to come on site at this time to help them get vaccinated yet. So in April, Sharon Cohan reached out to Walgreens and was able to bring a 300-dose Pfizer clinic on site directly to the employees so that they were all able to finally get their first doses of the COVID vaccines. And so equity and accessibility have always been really integral to our approach. Next slide. So a little bit of background with our program. We received funding through US Aging in April of this year to help target our vaccination efforts towards older adults and people with disabilities. Since we received that funding, we've been spending a lot of time onboarding our subgrantees and establishing a lot of different processes. And so this program is going to be rolled out in the summer. So we have not yet started delivering services along the transportation lines yet, but this is modeled after a program that I coordinated in 2020 for a Ride to the Polls hotline. And we saw a lot of success. So a lot of the structure of this program is taken directly from the best practices and insights that I gained during that time. Next slide. So all of these steps are basically about trying to make vaccination as accessible as possible. through the work we've done throughout the pandemic with the COVID vaccine clinics and community-based settings, whether that's been workplaces, Title I schools where we've had recurring hubs, and everywhere else that we've gone, we've seen that transportation can be a really huge barrier, especially for these populations that we're trying to serve, who really need it most. And we know that when we're able to help people meet their basic needs and help them really attend to their needs holistically, that makes vaccination itself more accessible. So we've started out with assessing the needs of our target populations. Here in Central Texas, we have a blend of urban, suburban, and rural settings. So Austin is a pretty large metropolitan area, but our outlying counties are pretty rural, and there are some great services serving all of those populations, but it can be tricky to navigate. We also want to make sure that we provide as many accommodations for as many people as possible. So looking for wheelchair accessible vehicles, looking for different language interpretation, ASL interpretation, and making sure that whatever level of care people need, that they're able to access that so that they can get to those vaccine appointments. Next slide. So once we've assessed the needs that we're trying to meet, that makes it easier for us to identify the local transportation providers. So what our process looks like is kind of creating a network that we're trying to make it as seamless as possible for the patients that we want to serve. So there are lots of great existing services, nonprofit organizations that provide free rides. Of course, our local transportation like Cap Metro and other public transit. And then we also do have some for-profit companies like non-emergency medical transport companies and other folks that we're working with just to try and make sure that we fill in as many gaps as humanly possible. And so with each of those providers, we try to get as much information about their eligibility criteria, any information that they need for intake for us to communicate to them. So, what type of wheelchair that they might be using, height and weight, and other essential information like that. And also getting information on just things like scheduling. So do they prefer to schedule, at least a week out in advance, as is the case with some folks, or can they accept same day or next day rides even? So we try to get all that information along with the rates if they are charging us, so that we can establish those processes and make sure that everything is good to go. And next slide. And that helps us to develop our internal criteria and processes. So the way that our process is working is that we will have a phone number that people can call that we are sharing out with our different partners and different organizations in our network that they can share with the clients that they serve. And when they call us, we will be able to walk them through all the information that we need to get and take that information and go to the providers directly and see who we can get them a ride with. And to just make that as easy again as possible without creating additional barriers and additional work for people. And also knowing that sometimes the expenses, depending on what level of service they need, can be a little bit prohibitive. So we want to make sure that we're able to cover those costs. Our intake form has all of this information that different providers need. And we also make sure that we are staying in compliance with our grant requirements. So serving our target populations and collecting any additional information that we need. And then our response time, our target is to confirm an appointment within 1 business day. So that gives us a little bit of time to make sure that we can reach out to a couple different people if we need to, but also make sure that we're reaching people in a timely way. Next slide. And so along the way, we'll be documenting calls in a database. So documenting all of the intake information so that that's readily available. We can make follow-up calls as needed, and we can call or text appointment reminders to folks. And we can also get feedback in real time. Next slide. And yeah, so for example, with some of the real-time problems that I've addressed in the past, we had a person who was deaf, and he had been trying for a very long time to try and get out to early voting. And so there were a couple different barriers in place there. And so we had worked with him over the space of about a week of making a concrete plan. And then on the day that his ride was scheduled to pick him up, it was a non-emergency medical transport. On the day they were scheduled to pick him up, they were running a little bit late. And then they also needed to know that they needed to ring the doorbell, which would signal the lights on and off for our caller so that he would know when he needed to come down. And then additionally, we had already worked with the local board of elections in his jurisdiction to make sure that there would be an ASL interpreter available once he arrived. And so having that information, I was able to call the non-emergency provider, give them a call, make sure that I knew where they were at so that I could relay that information to the caller and make sure that they had all the information they needed to know about how to best accommodate our caller. So that's the kind of information that we try to really that we want to stay on top of and collect. And again, just make this as simple as we can. And so as we go, we'll be soliciting feedback from our callers. You know, there are always gaps in our knowledge, always gaps in the needs that are being met. And so being able to solicit that feedback, we can then kind of go, you know, between them and our team, discuss any quality improvements that need to be made. Next slide. And so we'll be refining our processes as needed, whether that's, you know, adjusting kind of the process that we go through with providers based on anything that comes up, adding to our network of providers. And so again, just as a couple examples, so we'll be working with some of the nonprofit organizations that provide free rides, but some of those organizations do require that all patients be completely ambulatory. And so we are working with some other companies that do have transportation options for wheelchair accessible vehicles, including a company that is staffed by physical therapists. So they are able to provide a slightly higher level of care, including some patient advocacy and just being able to provide more physical assistance to people who might need that. And so that's just kind of all part of trying to always improve the accommodations that we can offer to people. And again, we just want to make this, we know that it can be a really complicated process, both through our personal experience with loved ones in our lives and with the pandemic work that we've already done. Every organization has different criteria, different zip codes they serve, different distances they can travel, sometimes different age limits that they can accept. And so all of this is really to not deter anybody from doing that very important step for themselves of getting vaccinated and attending to their other healthcare needs. So we want to make this as seamless as possible and to take on the burden of this work ourselves and ensure that they are able to get their needs met. Next slide. So here's our information. I know we'll have some Q&A time at the end. If any other questions come up, you're always welcome to reach out to us directly by email, by phone. You're also welcome to check us out on our website or social media for real-time updates of how things are going. So thank you.
Thanks so much, Jenny, for your presentation. I popped back on because we're going to see if we can get Jennifer back. Jennifer, do you want to come on screen and see if you're okay?
Sure. Can you hear me?
Keep talking. You have to keep talking.
Can you hear me? Are you good?
Okay.
How does that sound?
You sound good. So let's
Oh,
all right. It's a little low, so you may have to shout a little bit, but we can hear you clearly. So let's try this again.
Okay.
Take two.
Well, we'll take it all and go quickly and clearly about it. So the Virginia Disability Vaccination Collaborative just started and rolled out this year. Next year, I'll go over the basics. Next slide. So we found national organization across the disability and first populations. That's the information they provide all assistance, guidance, to our grantees. The other part is the grantee.
I'm sorry, Jennifer, this is Melissa again. I
Yeah.
hate to interject, but just for accessibility's sake, I can't continue to let you go. So if you can try to dial in, we'll get you in the tail end of the webinar. You're still a little robotic and kind of going in and out. So just for the sake of our attendees, I want them to hear you clearly. Thanks so much. So Seth, I'm going to kind of advance the slides quickly, and if you can get ready to present, that'd be great.
Absolutely.
You would think it was a Monday, everybody. I think I put these in the wrong order.
That Texas heat might be getting everybody.
It might be moving east. All right.
Hi, everybody. My name is Seth Wells. I'm the Executive Director of the Rise Center for Independent Living, and we're located in Beaumont, Texas. We're a non-residential center for persons who self-disclose as someone living with a disability. And next slide, please. So just a little bit about who we are. If you're not familiar with Centers for Independent Living, or CILS, we were first provisioned under the Rehabilitation Act of 1973, and in response to individuals with disabilities needing certain independent living skills and other services like advocacy, community services, and education, peer support, information and referral, and transition services. And today we are required to provide core services, independent living skills, advocacy, peer support, information referral, and transition services. That's both for youth in transition and adults and older adults, maybe transitioning from a facility back into independent living. We were founded as a Rise Center in 1996 here in Beaumont. And we, again, serve persons with disabilities, and we help them fulfill their goals of independence and self-sufficiency. Our services are offered. 99% of them are without cost, and we service an area of Jefferson, Hardin, and Orange counties here in Southeast Texas, which is roughly 2,400 square miles. And we have a total population of close to 400,000 of potential consumers. So we do have quite a large area for our federal funding that we service, but we also have an additional 9 counties that we offer transition services for through another CIL in Austin called ARSO, which is the Austin Resource for Independent Living. So we work with them as a sub-grantee to assist persons transitioning in additional 9 counties. So we service 12 counties in Southeast Texas. Next slide, please. Just a little bit about our mission. This is a picture of one of our favorite people. This is Ralph, our board president. And so our center promotes the idea of the full inclusion, equal opportunity, and participation of persons with disabilities in every aspect of life. We don't want to separate our friends with disabilities. We want them to be a part of our communities. We want them to be active in our communities. And one of the big things, some of our main missions are to let folks with disabilities know and others know that people with disabilities have the right to make choices affecting their own lives, and they have the ability to do that. A big one is the right to take risks, and the right to fail, and the right to succeed. So every day we take risks, and we should allow all of our community members that same independence and that same freedom to be able to make decisions based on their own needs and goals. Next slide, please. So in our area, not unlike many other parts of the country, we have some serious transportation barriers, and these are just a few. It starts with the lack of fully accessible bus stops in our area. We do have, in Beaumont proper, we do have public transportation, but a large percentage of our bus stops are not accessible. And if you know anything about Beaumont and our area, we are susceptible to hurricanes. So even when we don't have a hurricane, we average about 60 inches of rain a year. So many of our bus stops are not covered. They're not fully accessible to access. So the ridership is low, based on the fact that many of our friends that would need to utilize that service can't even access the bus stop. Additionally, there's areas of service with no public transportation services. It's solely reliant on private entities. There's limited inter-county transportation service. So Beaumont is kind of our main hub here in Jefferson County for other areas, both economically and medically. We have large oil refineries, and a lot of people come to our area to work, and we have two major hospitals here. But there's still quite a lack of regular, reliable, low-cost, accessible transportation to Beaumont and back to other areas of service. Additionally, there's limited paratransit services provided by the city and county. There are many entities that are trying to do that, and we're trying to expand that, but right now it is somewhat limited. The cost of private services are often too great for a majority of our consumers, so they just can't access that due to many of them being on a fixed income. And really a lack of information on public transportation routes and services. There's a lot of people that just don't understand how it's working or which bus route I need to take and how do I make a transition. So we work with the center and with our consumers to try to address all these issues. And if they have they can always come up to the center and we can discuss how and do some training on that. So that's one way we try to address some of those barriers. Next slide, please. So just a little bit more about our center. I'm going to get to the vaccine stuff, I promise here. But it all starts with in COVID-19. I started working at the center in October of 2019. So I got about 5 months of somewhat normalcy until the big event in March 2020 on. We immediately transitioned to working from home due to the risk of COVID-19. But we never stopped with providing services for our consumers. And one of the big programs that we were able to start during COVID-19 with the receipt of CARES Act funding was a Rides with Rise program. And we partnered with Nutrition and Services for Seniors, which is our local entity that provides Meals on Wheels in the area. They provide 1,500 meals daily, but they also have wheelchair accessible transportation, which they were doing up to 3,600 rides a month pre-COVID. But then obviously that number dwindled down. But they reached out to us about starting a partnership, and we thought we were going to be starting with food, but they came to us with the transportation idea, and that's how Rides with Rise was started. Next slide, please. So again, one of the common barriers for persons with disabilities is reliable, low-cost, accessible transportation to access their various goals. And we found with NSS they have a small fleet of vehicles that is able to provide these services. And they also receive grant funding that will allow persons who are ambulatory to qualify for low-cost rides. But unfortunately, due to grant funding, persons that use a wheelchair would not qualify for the low-cost rides. So instead of $1 to $2.50, it could be anywhere from $15 to $25 for a one-way ride. And they reached out to us and thought that maybe we could help fill those gaps of service. And thankfully, we were able to do that. Initially, we were able to give folks rides to the grocery store, to their financial institutions, and to medical appointments. And since the inception of the program, we've been able to provide 5,500 rides to our consumers and other folks in our area. Next slide, please. So a little bit about how it works with our program. A consumer's eligibility, they're initially referred to Nutrition and Services for Seniors to see if their eligibility for their low-cost rides is available. If not, they are then referred to the Rise Center, and we intake them as a consumer, and we start the process of developing an independent living plan with goals needs and goals that they want to achieve to maintain or improve their independence. So we would talk to them about their needs. What kind of rides will you need for the next month? And based on those goals and those needs, we allot a number of rides to that consumer. We then work with nutrition services for seniors through a digital portal, and we approve that and send that to nutrition services for seniors, so the consumer can then go through an intake and procedural process to make sure they understand what to do, how to schedule their rides, and they require 48 hours notice. And this is also independent living skills training for our consumers. We do not make the appointments for our consumers. If they need accessibility, or if they need a way to better access that, we can get them to the center to help them do that. But part of the independent living movement is obviously letting folks get out there and try things for their own and see how it works for them. And that also gives them an onus of control over their own life and then their own transportation needs. So, and then at the end of the month, we are only invoiced for the number of rides that a consumer takes. So that's how, if they're approved for 10 rides and they only take 8, we're obviously only going to pay for the 8 that were taken. And those rides do not roll over. At the end of every month, we ask our consumers to call us back, and that gives us a way to check on them and see how their month went, how their appointments were, and then update their independent living plan, and then work for another goal for the next month and see what options may be needed for the next month regarding transportation. Next slide, please. So as far as the vaccine transportation, we're setting the groundwork now through the summer to set up really for the fall for the big push into the cold and flu season. With that, we've been developing more partnerships. So we've expanded just from nutrition services for seniors as a transportation provider. And we've made additional MOUs with a local adult daycare center and federally qualified healthcare centers with transportation programs or in-home vaccination services. So we love the idea of vaccine clinics, and we know that we would love to do that. But the thing that we want to try to focus on is getting people to a place where they're comfortable to take their vaccine, either that's their primary care or to a place like United Hands or a Gulf Coast Healthcare Center. We're also trying to expand our partnerships to allow consumers more options. We're using a template that we've seen work very well in Austin area with Arcel. We're reaching out to local churches or local Catholic dioceses to see if we can set up transportation to their church service and also hold vaccine clinics there. Additionally, we have a population that experiences homelessness in our area. So we want to try to make an impact in that community as well. So we're developing a partnership with the Salvation Army and other services that serve persons experiencing homelessness to address needs for that population. And as a veteran, I'm also highly involved in what's called veteran stand downs in the area, which are resource fairs in every county that we attend and help plan that address veterans experiencing homelessness, or veterans in need and their family or others in need. And we've had some success with getting some vaccinations prior to this at a veteran stand downs, but there's a real disconnect between our veteran population and accessing services here in the area. Our local CBOC clinic, which is a community-based outpatient clinic, does not have wheelchair accessible transportation. And we are only 70 miles from Houston, but 70 miles may as well be 700 if you have to pay hundreds of dollars for a ride to access your care that your service should have been provided for you. So we work with all different types of populations that are underserved and unserved in our area to try to fill the gap. If we see the gap as a transportation service, that's a very simple thing that we think we can help provide and try to address. Next slide, please. This is just some show off stuff of what we've done so far. Everybody's big on incentives and gift cards and things for vaccines, but I'll tell you what, these pens that are shaped like shots are by far our most popular thing that people want to take from our table after learning about some of our vaccine education and outreach. So it doesn't always have to be a big thing. Sometimes it's something that just catches your eye and fuels your imagination a little bit. And we do all this with a great staff. I have a fantastic staff. We're a very small center, but again, with only 4 to 5 full-time staff, we've been able to give 5,500 plus rides over the 3-year program, helping over 200 people access medical care or other independent living items that they may not have had the opportunity to do that. So as much as we appreciate everybody, I really appreciate my staff and all the hard work they do. And I think that's it. One more slide, actually. So again, this is a way you can contact us. This is our phone number, website, and Facebook page. And one of our mottos around here is help the person in front of you and repeat. And thank you for everyone for what you're doing and helping us do what we do as well. Thank you.
Thank you so much, Seth. Great slides. I love those pictures. You have to send me one of those pens when you get a chance. All right, so I think Jennifer is on the phone. So I am fingers crossed success with this. So we are going to Jennifer, have you come off mute and just let me know when to advance your slides.
Okay, can you hear me? And do I sound okay?
You sound just fine.
Oh, what a relief. Third time is a charm. All right, so I think we can go to the next slide. The Aging and Disability Vaccination Collaboration is made up of 2 sets of grantees. National partners, we have about 23 across the aging and disability and diverse population network that really help us with technical assistance, support, resources, really just helping us reach people that are often underserved or unserved and hard to reach. And then we just heard from some of our wonderful grantees. We have, community organizations, AAAs, all kinds of organizations in our network that are doing the hard work on the ground. And right now we are over 100 grantees and they have multiple partnerships. Great examples were just given. And so really that is just exponentially, there's probably way more than 100 or 200 grantees technically with all of those partnerships in place. So next slide, please. All right, then, so that is kind of an overview. So there are 3 specific things that we report on for this grant. The number of vaccinations, and they are focused on COVID and flu shots and boosters, but they can also include shingles, pneumococcal, and other vaccines. So those are recorded, but this vaccination does focus on COVID and flu. The other thing we track are supportive services like transportation, assistance making appointments, any kind of personal support or referrals. So, Seth's 5,500 rides, just love to hear things like that. So anything within this grant, that any ride he would give would count as a supportive service. And then finally, outreach and education. So those numbers are just amazing to watch them grow because, every time you send out an email or people are putting up billboards, having tabling events, all kinds of things are coming in. We've got tailgates planned, concerts planned, state fairs. So the outreach and education is going to be just such an amazing and fun thing to watch these numbers go up so quickly. And then those are all reported in a system called Cumulus. It's great. I won't get into the weeds about it, but it's a really easy to use reporting system for tracking programmatic reporting. Next slide, please. Thanks. Sorry, I'm tracking slowly, I think, on my phone. So the application is really simple. We've tried to simplify it. We know people and staffs are stretched, that some of the reporting requirements and application processes of some grants can just be so burdensome and take up a lot of your staff time and resources. So we've really tried to leverage 2 platforms, Submittable for the application process and Cumulus for the reporting, to make things really easy and simple. And we really are a team that wants to walk side by side with you in this and provide as much support as we can. We hold weekly office hours. Every grantee has a grant manager assigned directly to them. We have a communications and outreach director who's working on some really great materials that are going to be plug and play. We have translation services. So there's just so much support during the application process and also during the grant administration process. So we're always, growing and looking for ways that we can be a true partner in this. So next slide. Oh, I think, so I'm still on application overview on my phone, but hopefully we're on if we can go to the next one with the map, that would be great. Thank you. This is our current coverage. So all of the filled in states are places where we have grantees, and then the locations of those grantees are the little yellow dots. So we are really hoping to fill in, some of those states that are not filled in yet. We have some applications still pending in a few of those states, but we'd really love to, if you have a network of folks and you know anyone in these states, we really would love to have coverage in all states if possible. We are going to close out the grant, anticipate closing out applications August 11th in anticipation of a pretty robust vaccination season in the fall. So we'd really like to have everyone onboarded and in place, getting to know their grant managers and understanding the reporting requirements and just being really ready to go this fall. So I know I hurried through that, but I want to make sure we leave time for questions. So next slide, my contact information is there. Jennifer Hammer, feel free to reach out to me anytime, or we also have an email. It's advc@usaging.org. And thank you so much. And I'm really sorry about the technical difficulties.
All right, thank you, Jennifer. And I'm going to go ahead and stop sharing. And we have a little over 15 minutes for questions, which was my hope. We have quite a few in the Q&A, and so I can go and read the questions. I know there's about several of you on here, so if anyone feels most inclined to answer a particular question, just jump right in. So with the first question, are there opportunities for home care agencies to administer COVID-19 vaccines in a client's home? Any takers?
One more time, the question, I'm sorry.
Sure. Are there opportunities for home care agencies to administer COVID-19 vaccines in a client's home?
I know that this is Seth Wells with the Rise Center. Our adult daycare partner, United Hands, has nurses on staff that they just got their Medicaid certification, so they do have the ability to go in-home to do in-home vaccinations for those that aren't comfortable with coming out of their home or don't have the ability to do so.
And I'll piggyback on that, Melissa. You can partner with a for-profit agency to help you, administer vaccines. And I should say too, this grant will not pay for the actual vaccine. So that's something to be aware of as well.
Judy, did you want to respond to all of that?
Yeah, I was just going to add that we definitely know that the need is out there for more in-home vaccinations. We've typically been relying here on our public health departments as they've still been doing some in-home vaccinations. But yeah, that need is definitely there.
Great. Thank you. Another question, how do you reach hard to reach individuals? What kind of marketing do you do, particularly for people that don't use the internet?
So for us, we are partnering with a number of different groups. I think I mentioned we have a few sub-grantees. And so a lot of them do provide culturally specific services. They're well-established organizations like the Austin Asian Community Health Initiative. And then we have another aging and disability nonprofit organization that has a really strong outreach program towards the Black churches on the east side of Austin. And so we're relying on a lot of those organizations that have already been on the ground and have these established relationships and a lot of different methods that they know have already been effective to do that outreach. So we'll be relying on them pretty heavily and then expanding our outreach from there.
Great. Seth?
So we're lucky enough for our local radio stations, that conglomerate requires their DJs to do community spotlights at least once an hour. So for a little while there in our own building, we had a radio station downstairs. So I was able to go and reach out to the radio stations and they provided a free service for that. So that might be an option to reach out to your local radio stations. To do that, for our consumers, we have a lot of senior consumers, so we try to send out, we do a mail out, and we've done our best to try to do some training on text messaging for either through Remind app or other services like that to try to get that out to them, even if they aren't entirely savvy on how to get and use their smartphone. A majority of them are now having one. So we are at least some type of cell phone. So we try to do that through text messaging, and also in other areas, there's bilingual radio stations that we've targeted and worked with for our veteran stand downs, and we're expanding that as well. So radio has been a big help for us in the area, and also just connecting with other volunteer organizations through something called VOAD, which is Volunteer Organizations Active in Disaster. We're pretty connected here due to the number of hurricanes we have. So there's many different outlets that we try to use other than the internet.
Absolutely. I think I skipped a question. So both of you all could answer this one. How do you handle protected health information?
So we are kind of in the process of upgrading some of those processes. We were a grantee under one of the CDC grants administered through our public health department. And for most of our vaccine clinic work, a lot of the information that we've collected has primarily been through Google Forms. And so for this, we may be adding an additional layer and having an ROI in place, since we are collecting a lot of health information about people's various needs and accommodations.
Great. All right.
So via Teams is the way we usually are HIPAA compliant. So we use that secure electronic form system through Teams, Microsoft Teams.
Great. I know, Jenny, that this was a question for Together Austin. I know you're typing the answer, but it could be a question and a response that others, may benefit from. So the question is, how are you getting the various transportation providers in your community to come to the table to discuss options that each of them can provide? I think that's a great question.
Yeah, absolutely. Mostly we've just been reaching out to people directly once we have their information. So doing some research on who the providers are, making phone calls and emails to set up some time to discuss their various options. And we really kind of just go from there. I think so far everybody has been really receptive to having those conversations. We also had attended a local webinar about local transportation options for seniors and people with disabilities. So we were able to get quite a bit of information on various providers on the nonprofit side during that time. And so we were able to get a lot of information.
Great. Thank you.
Yeah, originally, we got lucky and we were able to partner with our original transportation provider. Some people say it takes is money, right? But it also takes people discussing the issues that people are dealing with. And what we try to focus on in the beginning is gaps. So small groups of the population that we can affect directly and show people how easy it really can be to fill those gaps. But just like Jenny said, reaching out and doing one-on-one contacts. And we have a very good relationship with our local COG, or Council of Government, which provides, it is the hub for many of the transportation services for our rural and other areas. So just reaching out, join committees, be on boards. Oftentimes it's just finding the right person to ask. Sometimes what I've found is putting it out there enough times that somebody is going to see the obvious thing that we can do here. But the focusing on the gaps is one thing that we really try to do and show that example of what can be done.
Great.
I would just echo what Seth said, and that's what we are trying to do as well. You know, when we attended that webinar with all the local options, first of all, there were so many, it could make your head spin. You basically needed a tree to kind of follow down all the different branches of, okay, so you live here and you have these requirements and you're eligible for this and this, but not this. And for this, you could have a caregiver. And for this, if you had a mobility challenge, and it was complicated. And so what we were hoping to do was make it more simple for the consumer, even if it's still somewhat complicated on our end. And not to take away independence or to take away autonomy, but we figure that by the time they're getting to us, they've exhausted most of those options and now they're looking for help. And so that's kind of the model that we've taken. But I really appreciate, and I wanted to acknowledge Seth listening to kind of what you're saying, because I think that the answer is probably somewhere in between, and really identifying, asking some additional questions for how much help, and do you want to take it from here, or do you want us to continue that process? And I really appreciate that. So I just wanted to share that was very heard.
Great. Another question, what kind of ride scheduling software are the both of your programs using?
Well, the Ride Center does not schedule any of the rides. We're the gateway to the transportation service. And I saw that question as I just realized that they switched to a new system, and I do not know what it is. But we do not schedule any of the rides ourselves. We just approve the amount of rides that a person can take, and then nutrition services for seniors and our other providers handle the actual scheduling of the ride. But I will find that information out, and I'll get it to you, Melissa.
Okay, great. Thank you.
For us, we are basically just going to be including that information and the intake information that we collect. So once we have an appointment time established with one of the transportation providers, whomever that might be, we'll have that documented in the database that we're keeping, and just have that as a reminder.
Great. Thank you, Jenny. I think we addressed the in-home vaccination question. We've got quite a few additional questions. And so just wanted to let you all know, if we don't get a chance to get to your question today, I'll get them to our presenters, and in our follow-up information, we'll make sure that we get responses out to you. So how are you working with the vaccination clinics? And so I think you may have addressed that within the presentation, but if there's anything additional that you maybe have not covered so far, anything else unique that you might want to say about working directly with these clinics, please do.
Yeah, we do a number of, again, we do mobile clinics. So we've gone to, we've had a couple of Title I schools in our school district that we have returned to for probably over a year and a half at this point. And so we have some other established relationships where we go back and do clinics there ourselves. And then with the transportation piece, we'll just be also coordinating, whether it's one of our clinics or if they just need to go to a local Walgreens or whomever their provider is that they're comfortable with, we'll just go ahead and get that ride scheduled so that they can go to their preferred place.
All right, thank you. There was a question about education, about the various modes of transit, particularly the difference between paratransit and general demand response transportation services and accessibility requirements. So I don't know if you all have anything, and I don't know if that's in relation to getting folks to vaccination. So if you have anything, and that was Kristen, if you want to send a follow-up question to kind of to clarify, but I'm assuming it's around getting folks to vaccination and using paratransit versus your demand response. So if either one of you have used both in your programs, if you want to address that question, you can.
For our local paratransit system, it's pretty cumbersome, actually. Most rides in our area require at least a 48-hour notice or 24-hour notice. In Beaumont, you actually have to call the morning of your appointment and try to be one of the first 30 to 40 people that access that service. And you also have to be approved beforehand. Because of that quick response time, we just try to either approve them for a month of paratransit rides or provide them the number of rides they will need for bus passes for that. But we're working with the city of Beaumont to try to alleviate that need for that type of system, because once you ride it for a few weeks, then you then establish, I don't know what they're needing to establish, but you establish your need, and then you can become on a more regular basis for the door-to-door service. But yeah, again, we usually leave that in the onus of control of the consumer. If they have issues, we follow up with them in the city of Beaumont with that. But we usually pre-approve them for a certain amount of rides if they feel comfortable on that type of transportation, and work with them to try to address any issues. I hope that answers
I
that.
can say, and I'm on Maryland, I know I'm late hopping on, but I just want you to know the one thing that we have done is we have partnered with our multicultural organizations that have a van service. And we have given them funds out of our vaccine money to offer transportation to these multicultural. We have also actually have hospitals that are working with us will actually do the in-home vaccines if we deem that we have people that cannot get out of the house. We also have a number of volunteers that are willing to offer transportation. We have done hot spotting with Maryland on my primary care, so that we actually know where these physician practices are that do not offer the vaccines, because we have contracts with the Maryland schools of the pharmacy, so we can put specific vaccines in those areas. So we've been very strategic on how we've been trying to align the clinics versus where that we need transportation. And I'm so sorry I'm late joining, but I hope that my slides can be shared.
No, absolutely. Thank you. Thank you, Leanne. We will share your slides with the master slide deck. Everyone's Leanne Eco with Mac Inc. So we've got a couple of minutes and still quite a few questions. So I'll try to punt two more out to you all. And again, as I mentioned, everyone who's attending will try to get these responses to you in our follow-up email. So another question. Well, can one of today's presenters provide more information on who to contact to be eligible to offer in-home vaccinations? I'm assuming that would probably be you, Jennifer. I guess through the program, but I don't know. Do you have any additional information for that?
No, that's probably really going to be a local partnership, because I'm not, this is a nationwide grant. So it's really, your local networks and who can provide and bill for in-home vaccinations. We do have the office hours, and people share that kind of thing all the time with ideas.
Okay. Not sure what this one is. Someone asked who is the contact person in California. So if you did put that question in the chat, in the Q&A, if you want to send a follow-up, we can get that addressed for you. Another question, how are you working to get people motivated to receive vaccines, given that a relatively small number of people elected to receive the bivalent vaccine?
Yeah.
Yeah.
We are in Maryland using something called My Chart, which is through the hospitals, and each doctor's office has a different kind of My Chart where we can send out these say, okay, it's time for your COVID vaccine, it's time for your flu vaccine. And because that looks like it's coming from the clinical side, that's really, really helpful if you can generate those kinds of partnerships that, that you have these physician practices and, and the hospitals that can do this for you.
Thank you. Anybody else want to address that question? How are you getting folks motivated?
Sure. So we're trying to get creative and kind of pair vaccination efforts with a lot of outreach and fun activities for people to get involved in. So we're underwriting some musical theater shows where we'll be doing senior and accessibility nights with ASL interpretation and audio description services. We're also going to be planning some game nights and other things where people can come and have a good time, but also get their vaccine while they're there. And we're hoping that also just by helping people meet basic needs, so doing giveaways of summer preparedness supplies and things like that, that will also encourage people to kind of, again, holistically take care of their needs, and vaccines can just be one piece of that.
Okay, great.
Yeah, just various types of different incentives, small gift cards, it's, we're fighting the heat here. So we're trying to get people to go to Sonic and do that, or provide food, or other options like that. I really like the musical theater idea. Yeah, we have a high hesitancy rate here. So just trying to, another reason why we partner with healthcare centers. We just want people to get information, whether or not what they do with it is up to them, other than social media. So from a doctor is more preferred.
Okay, great. Well, we are a little over time, so I want to thank each of our presenters today, Jenny, Seth, Jennifer, and thanks, Leanne, for joining in during our Q&A. As I mentioned earlier, we will get the slides out to everyone, and they will be posted on our website as well at nadtc.org. My colleague has just dropped a link to our evaluation to this webinar, so we invite you and encourage you to please fill that out for us. It just helps us to present and shape more programming for each of you all to participate in the future. And with that, thank you again and have a great afternoon. Bye-bye.